I think tests are a really important tool in our toolbox to keep ourselves and our families and our communities safe from COVID-19.
That's Dr. Emily Volk, president of the College of American Pathologists and chief medical officer at Baptist Health Floyd in Kentucky. She explains the ins and outs of COVID-19 testing and frequent questions patients may have.
It can be helpful to try to sort out the difference between, do I have seasonal allergies or do I have a common cold or do I have COVID-19? So that at-home test can be helpful in that situation.
Dr. Volk is interviewed by AMA senior news writer Sarah Berg. Here's Sarah.
Thank you, Todd. Hello, I'm Sarah Berg, AMA senior news writer, and you're listening to Moving Medicine. Throughout the pandemic, knowing the ins and outs of testing has been difficult. Patients wonder when to test, when not to, the importance of testing, and have questions about whether they are experiencing a cold, allergies, or COVID. Today I'm joined by Dr. Emily Volk, president of the College of American Pathologists. Dr. Volk is also chief medical officer at Baptist Health Floyd in metropolitan Louisville and an associate professor of pathology at the University of Louisville School of Medicine. She's going to share her thoughts on these questions and on what doctors wish patients knew about COVID-19 testing. Welcome, Dr. Volk.
Thank you. It's great to be here.
Prior to her current position, Dr. Volk was Senior Vice President of Clinical Services at the University Health System, San Antonio, Texas, and Clinical Assistant Professor of Pathology at the University of Texas Health Long School of Medicine. Dr. Volk, could you give us a quick background on yourself and your work?
I'd be happy to. I've been a pathologist for over 25 years. I have boards in anatomic and clinical pathology as well as cytopathology. I chose pathology because we get to look behind the scenes, under the curtain, and stare disease directly in the face every day. We provide the answers that provide the guidance that leads to patients getting the right treatment for their diagnosis. Everything starts with the diagnosis. I encourage all medical students to consider this terrific specialty.
Great. So let's get into our conversation. When should you use an at-home test versus a PCR test, especially with masks going away, more people returning to work in offices, allergy season, and just the common cold? It seems there are a lot of reasons why people would have COVID-19 symptoms.
Well, that's a great question, and I get that question a lot. When is the at-home test a better choice than a hospital laboratory or reference laboratory PCR test? Some things to know about these two different kinds of tests. The at-home test is an antigen-based test, and it is not as sensitive or specific, meaning it doesn't work quite as well as the PCR test done in a laboratory. However, its convenience factor makes up for a lot of its deficiencies. So what do I mean by that? The fact that you can actually test yourself and get a reasonably accurate result within about 20 minutes can be very, very powerful. It's very important, though, if you use those tests at home, that you treat them with the respect that they deserve. One of the things I like to tell people is, I'm not a direction reader. I tend to want to open things up and, just get right to it, start swabbing and dropping and so forth, and not take the time that I need to really do one of these clinical laboratory tests at my kitchen counter. So what I love to tell people is when you're doing a COVID-19 test at home, be sure and make sure you are actually reading the instructions, paying full attention, taking away any distractions, the doorbell ringing, your phone beeping, and so on, and give this your full attention. You are doing a laboratory test. It is important to use these tests in a way that will be impactful. Testing yourself after you've been in a high-risk situation can be useful, although the tests are more accurate for patients who are symptomatic. It can be helpful to try to sort out the difference between, do I have seasonal allergies, or do I have a common cold, or do I have COVID-19? So that at-home test can be helpful in that situation. Here's the thing: if you have reason to believe that you have been exposed to COVID-19 and you're symptomatic, and you're running the risk of maybe being around people who might be vulnerable to severe COVID-19, I strongly recommend following up a negative at-home test with a laboratory PCR test, either at your local hospital or clinic.
In general, when should you be testing?
Well, there's a lot of different situations where people are testing these days. Certainly, if you're symptomatic and you think you've had a possible exposure, you should be testing. We are seeing businesses and events testing folks with the rapid test, in addition to asking for proof of vaccination and booster to keep group situations even more safe than they would otherwise be. So I think, testing can be used to mitigate the risk of being in a crowded indoor gathering, as long as everyone is willing to submit to testing and follow the results of the test, not ignore them. And it can be very useful if you are symptomatic.
Okay, that's all good to know. What is the impact of vaccination and boosters on deciding when to test?
Well, I think that having a vaccine and a booster on board certainly lowers your risk of developing severe COVID-19. It lowers your risk of death from COVID-19 for sure. But we do know now that getting vaccinated doesn't eliminate the possibility of actually contracting COVID-19. So really having an exposure to COVID-19 and then developing symptoms, even if you're vaccinated and boosted, doesn't give you a pass from getting tested. You still should be tested. Why? Well, first of all, not everybody can be vaccinated, so there's still a vulnerable population out there to protect. And so if we know we're positive for COVID-19, even if we're vaccinated, we need to make sure and do our best to protect the vulnerable by staying away from them while we're positive with COVID-19 and while we recover. Otherwise, I think it's important to be vaccinated, but it is not a panacea. It doesn't cure it all for COVID-19, but it does prevent people from dying from the disease.
And what impact do the variants and subvariants have on testing?
From a practical perspective, the subvariants and variants have not really affected patient testing. The laboratories are doing a really good job making sure that the variants as they are developed are still detectable with our current testing methodologies. There has not been too much of an issue with a change in sensitivity or specificity around the changing variants at this point. The variant testing is really important from a public health perspective. And this is largely done behind the scenes. And so when you get a test result from your hospital or physician's office where you have gotten a PCR test, your test result is not going to tell you if you had a variant or not. That is information, again, that the public health teams are using to track the virus's evolution.
Okay, that's really good to know. How important are tests now that everyone is trying to obtain this new normal?
I think tests are a really important tool in our toolbox to keep ourselves and our families and our communities safe from COVID-19. Again, it's spring here in Louisville, Kentucky, and we've got all kinds of lovely allergens floating around in the air that make my nose run constantly and occasionally will make me feel tired. And these are symptoms that you can see if you have COVID-19. So it's really helpful for me if I'm going to go into a situation where people are not vaccinated to test myself to make sure that I'm not missing uh, a very low level or a very mild form of COVID-19 that I might be carrying, even though I'm fully vaccinated and boosted. Um, again, for those who are not vaccinated or who may be vaccinated and immunosuppressed, who have other risk factors for whom, antivirals may be an appropriate intervention. Knowing for sure what's causing symptoms that mimic a cold or flu, knowing whether or not that's COVID-19 can make a difference in the kind of therapy that they seek, not to mention the directions they're going to want to follow about staying away from others.
What kind of communication should patients be having with their physician or public health authorities regarding their results?
I think it's a great idea if you come up positive for COVID-19 to let your doctor know. I think it's a good idea not only from a personal health perspective, so your doctor knows what's going on with you, so they can take better care of you should you develop worsening symptoms. But it's also important from a public health perspective, so the public health authorities can keep track of how widespread the virus continues to be.
When they do take at-home tests, what follow-up should happen from there? What's the timeline? Should it be in an immediate notification?
Well, if a patient takes an at-home test and it comes up positive, I think calling your doctor's office within that same day or maybe early the next day, depending on how late it is a good idea. Again, if you're, having symptoms that are more severe that you can't manage by yourself at home, I would recommend heading to an urgent care center or an emergency room.
Okay. What about negative test results? What should patients do with those? And are they trustworthy or just a false sense of hope?
Negative test results are important pieces of information, just like positive test results are. Again, if the test is done properly, and what I mean by that is if a home test is done by following those directions to the letter, though the test results are pretty reliable. But just like any other piece of medical information, you've got to take it into the whole context of what's been going on with that person. So for instance, if I again have symptoms and I have been at a nightclub, a couple of days before or the night before, and I'm suddenly not feeling great, and I get a negative at-home test, I'm probably I'm gonna want to go get a laboratory PCR test to follow that negative test up because my risk of exposure to COVID-19 is high. Now, if I have been by myself, I haven't had any visitors for several weeks, and I suddenly start feeling crummy. Maybe I've been to the grocery store a time or two, but it hasn't been very populated when I've been there, and I've been wearing a mask. And I take the test, and it comes up negative. I probably am going to feel a little better that I don't have COVID-19 because I haven't had a high risk of exposure. So really, everyone who's using that at-home test or really needs to take into account their personal circumstances about their relative risk.
Medicine doesn't stand still, and at the AMA, neither do we. AMA members are physicians like you who are shaping the future of medicine. Become a member today and join the movement. Visit ama-assn.org/movingmedicine.
Are there times when you shouldn't test?
I think it's important to not test to get the result you're looking for. So what do I mean by that? I mean, if you come up positive with a rapid at-home test and you really want to go to that wedding with your family that next, in the coming weekend, testing yourself, until you get a negative, probably doesn't make sense. You probably need to follow the information that you got from that first test and stay home from that wedding. I think the intention around the use of testing is actually fairly important. If you're testing after you have been diagnosed with COVID-19, you're going to want to wait about 5 days before you retest to see if you're negative and ready to be around other people.
Regarding BA2 or other variants, can some people show up negative on day 1 or 2 of symptoms and then test positive later?
Well, frankly, with any variant, someone could show up with a negative test for the first 2 days of symptoms, potentially, and then turn positive maybe on the third or fourth day. That's always a possibility, depending on how much of the virus particles they are shedding in their upper respiratory tract. What I mean by that is their nose or their mouth, if they're doing a saliva test. So a false negative test is always a possibility. Again, whether or not to retest someone depends on which test you used initially. Was it a rapid test at home or was it a PCR test? And again, what was the situation that preceded the testing event? So had they had a high-risk exposure or had they been staying by themselves? So I think, all of that information is really important.
Okay. Advice before seemed to be wait 5 to 7 days of symptoms before testing. Is that still important to follow? Why does that make for more accuracy?
The advice has been to wait 5 to 7 days of symptoms before testing in some cases. I'm not sure that's necessarily the thing to follow always. I think we're seeing folks who are coming up positive within a day or two of having symptoms. That being said, if you come up negative and you continue to have symptoms and you believe that you have a reason to have been exposed and you test negative at day 1 or day 2 of your illness, testing again may make sense if you think you really may have the disease and just had a false negative test. But again, remember, a false negative test is far less common than a true negative test, and a false positive test is far less common than a true positive test.
What else is important for patients to know about COVID-19 testing?
Boy, it's still really important to get vaccinated. I know that there are still people out there who, for any number of reasons, may not have gotten vaccinated yet. And I would really just like to encourage folks who haven't yet been vaccinated to reconsider with all of the information that we now have about the safety and efficacy of the vaccine. My sincere hope is that those who have not done it yet will reconsider and get that vaccine. The other thing is, I think it's really important to know to get those boosters when it's time to get those boosters. I think it's good to look at is what members of your family haven't yet been vaccinated, maybe because that vaccine wasn't yet available to them. So for instance, our children. So keep an eye out for developments with the vaccines that allow younger and younger children to be vaccinated. I have 4 kids of my own, and I can assure you, if they were school-age children, I would absolutely have gotten them vaccinated. Now, they are all adults, and they have all been vaccinated and boosted accordingly. The other thing I think that is really important is, the hospitalizations for COVID have decreased recently, and we're relieved about that. And the reason the hospitalizations have decreased is more and more people have been vaccinated. What I'm seeing as a pathologist and a chief medical officer is our hospitalized COVID-19 patients are almost always those who have been unvaccinated, those who've chosen not to be vaccinated. And quite frankly, it's tragic to watch folks become so ill that a machine needs to breathe for them. And in some cases, they die from this illness, and it really was preventable.
Thank you, Dr. Volk, for taking time out of your busy schedule to speak with us today. I know our listeners appreciate this information along with the work you're doing.
I would like to leave your listeners with one final thought. Pathologists are the best kept secret in medicine. We're the most important doctor the patients didn't know they had. And what I would tell you is that pathologists are the patient's physician, just like an internal medicine doctor is a patient's physician. So if a patient has a question about a laboratory test or a biopsy diagnosis or cancer diagnosis that they may have gotten, just like they might seek a second opinion on a surgical recommendation or a radiation treatment, they might want to seek a second opinion about any important diagnosis that a pathologist has made, just because these results impact the therapy that will come subsequently. Again, I just want folks to remember that the pathologist is also part of the patient's physician team.
Absolutely. Thank you so much for sharing that, and thank you again for joining us. I'm Sarah Berg, and until next time, please be well.
You can subscribe to Moving Medicine and other great AMA podcasts anywhere you listen to yours, or visit ama-assn.org/podcasts. I'm Todd Unger, and this is Moving Medicine. Thanks for listening.